আ- আমরা লাইভে এলাম, আমরা লাইভ লাইভ
We are on live.
কি হলো?
শুরু করছি।
হ্যাঁ,
বর্ণালী দি,
আমি আপনাদেরকে মিউট করলাম।
ঠিক আছে। প্রিন্সিপাল স্যার আছেন? ঠিক আছে স্যার, শুরু করে যাচ্ছি আমরা। বর্ণালী দি, শোনা যাচ্ছে তো কথা? প্রিন্সিপাল স্যার, শুরু করছি।
স্যারকে আনমিউট করছি।
হ্যাঁ, বলছি স্যার শুরু করে দিচ্ছি, তাহলে টাইম হয়ে গেছে।
Yes, yes. Go on.
প্রিন্সিপাল স্যার, শুরু করছি।
Go on.
Okay, okay, thank you, sir. Very good evening to one and all. Myself, Dr. Kaji Manjur Ali, Department of Nutrition, MUC Women's College, and organizing secretary of this webinar. I convey my sincere gratitude and welcome all of you in this webinar platform. For your information, I like to state that there are more than 1,300 registered participants. Hence, we have partitioned the platform. For resource person, Cisco WebEx, and for delegates, YouTube. If you have any questions, participants are requested. If you have any questions on webinar lecture session, please put your question in YouTube comment box. Concerning context of this webinar, I would like to state that due to COVID-19 pandemic, our attention has been shifted to different aspects of pandemic. But we know that care and maintain of normal health is very important, which help us to combat against different diseases. In this context, Women Study Cell of our college decided to organize the webinar on care of women's health for a brighter future. We know the health of families and communities are tied to the health of women. The illness of women has serious and far-reaching consequences for the health of our children, family, and even community. In this connection, the main objective of the webinar is to recapitulate and cultivate the different aspects of women health. আমাদের ওয়েবিনারের মুখ্য উদ্দেশ্য নতুন কোনো বিষয় নিয়ে পার্টিসিপেন্টসদের কাছে পৌঁছানো নয়। হেলথ যেহেতু খুব গুরুত্বপূর্ণ ইস্যু এবং বর্তমান পরিস্থিতিতে আমরা কোভিড-19 প্যান্ডেমিক নিয়ে বেশি আলোচনা এবং চর্চার মধ্যে আছি, তারই মাঝে আমাদের যে দৈনন্দিন স্বাস্থ্যের যে বিষয়গুলো সেগুলো যাতে না আমাদের কাছ থেকে বেরিয়ে যায়, তার জন্য সেই ইস্যুগুলো, সেই বিষয়গুলো নিয়ে জাস্ট পুনরালোচনা বা পুনরাবৃত্তি করা। To enlighten our participants, we have with us respected speaker, Dr. Gishpati Chakraborty, ex-senior medical officer, the University of Burdwan, and respected Dr. Anindita Roy Chakraborty, head of the Department of Nutrition, Maharani Kashishwari College, University of Calcutta. We have also with us Dr. Sukriti Ghoshal, principal of our college and chief patron of this webinar organizing committee, and also with us Ms. Burnali Chakraborty, in charge of Women Study Cell and convener of this webinar organizing committee. So before going to the lecture session or technical session on the specified topic, now may I request to our principal sir to say few words on today's webinar and officially inaugurate the session. Thanks.
Thank you, Kaji. So, good evening, everybody. I welcome you all to this webinar organized by the Women's Study Center of MUC Women's College. As you all know, the title of the webinar is Care Women's Health for a Brighter Future. So, three issues are interrelated: health, women's health, and brighter future. So I think that the webinar has been organized keeping in mind that in the corona context, other health issues have been pushed to the back burner. That means they are not drawing as much attention as they should. In fact, we have reports from various sources that even people suffering from diseases which require constant care, monitoring, they are not getting health services these days. How is it related to the question of gender? The webinar has been organized by the Women's Study Center of this college. As we all know, that women health should get a priority, but most often women health get neglected. And in the corona situation, this has become a very serious problem because many people have lost their jobs, income has fallen down, and food supply, food grain supply is low. And as the supply of food grain falls, women have to sacrifice their portion, their share of the food to the, they have to sacrifice it to feed the other members of the family. And this they do only because they are homemakers, but because in our society, women are, only in our society, globally, women are still, they hold a peripheral role in society. Another important thing that should be taken into consideration is that women are treated as not the earning but the cooking member of the family. Not that all women are, they can be put into this bracket, but most women in our society, they do not have no stable earning, so they are the cooking member and not the earning member. That's why the health of a male earning member, if a male person who is the earning member of the family falls ill, his health immediately draws the attention, health issue draws the attention of the family and not the health issue of the women. So poor attention is paid to this. The health of women should be the priority of society because as you know, the 90% of the parenting job in society is done by women. So I think that the webinar has been organized keeping in mind all the issues. I am especially thankful to Dr. Gishpati, who is senior to me and I have deep regards for him. I know him for many years. And I am also thankful to Professor Anindita Rai of the College of Kolkata University because they have agreed to enlighten us on this occasion. And in the corona situation, you know that Burdwan has been declared a lockdown has been declared in Burdwan from today. But one advantage of the digital platform is that despite in other situations we could have been compelled to postpone this webinar, but since it is all digital, therefore sitting at different places, we can go ahead with our program. I welcome all the participants to the seminar, in this seminar, and also personally express my gratitude to Professor Chakraborty and Professor for agreeing to enlighten the audience. I thank the Women's Study Center, Burdwan Chakraborty, and also Kaji Manjur Ali of the Department of Nutrition, who have taken so much pain. And I also thank the I College because the internal quality assurance cell is the academic activities of the college. So I want the webinar also. Thank
Thank you, Principal Sir, for your informative and valuable talk on this webinar, as well as context and motto or objective of the webinar. Now we are going to start our lecture session or technical session in the webinar platform. So may I request to Dr. Gishpati Chakraborty ex-senior medical officer, the University of Burdwan, to deliver his talk. Sir, please start.
Welcome everybody. Already regarding women's health, the whole matter has been clearly put before you, and already it is clear why we are going to discuss women's health in particular. Care women's health for a brighter future. This is today's central theme of discussion. Slide. Slide. First slide. Finish. The last. Okay. Now we can.
Oh, sharing when?
Okay. Okay.
স্যার মাইকটা সামনে নেওয়া যাবে, হেডফোনের মাইকটা
হেডফোনটা এই যেটা কোনখানে আছে
এটা মুভ করছে বলে একটু আওয়াজ আসছে।
আওয়াজ
হ্যাঁ।
আসছে না?
হুম।
Start. Slide. First slide.
Okay, it's visible now.
Okay. Okay. I think everybody can see it.
Yes.
Okay.
You may full screen it.
Now I can proceed it. Now make it full screen. Full screen. Full screen.
Just minimize WebEx. Click on start from beginning.
This one. This one.
Yes. Yes.
Okay. Thank you. Now we are going to the core subject. Care women's health for a brighter future. Okay. As the introductory part has been clearly delineated, I am not going to introduce in a repeating manner. So straight away I am going into the subject from technical standpoint. Now we consider nowadays from mother and child as one unit, from the aspect of health care particularly. When we take into account mother, or when we take into account the health of a child, we are bound to look to the mother. Actually, just after birth, for a definite period, the infant that is below 1 year, the way we defined infancy, and beyond 1 year, under 5 children, particularly the preschool, they are completely dependent on and in developing region, mothers and children constitute approximately 71.14% of the population, and definitely this thing particularly points that we focus to mothers and why. From the standpoint of sheer number, Southeast Asian region particularly, and definitely India, Pakistan, Bangladesh, and other parts, and definitely all the countries in SAARC, the mother and child are heavily under different types of deprivation. From the standpoint of mother's health, we know the very common occurrence in India, particularly among mothers, is anemia. Definitely, if we go through the statistics, we will see that infants who are underweight, that is, in Indian context, below 2.5 kg, constitute a very large portion. And when children who are growing, particularly from this area of undernourished situation, most likely to have some developmental problems, to have vulnerability to mortality and different types of morbidity, that is, different types of disease. In Indian context, we know, apart from the legal consideration of marital age, marriage around 14 or 15 years is not very uncommon. And for this reason, when they are going to the childbearing state, it is particularly taking a major risk towards mothers. And after childbirth, definitely they are under different types of conditions, particularly infection. And if you go to the different wards in hospital, in the neonatal care unit, you will see many infants under critical care. Infant under critical care is a very bad condition, and definitely this is a scenario, this is a picture what we see. Next. In India, women of the childbearing age, that is the childbearing age is legally we consider is 15 to 44 years. They constitute 22.2% and children under 5 years of age constitute 35.3% of the total population, and together they constitute 57.5% of the total population. Here we are considering the particularly childbearing area. And this area should be kept under focus. From the standpoint of healthcare, if we constitute and if we consider a particular situation, we will have to take into account one thing, that as they constitute a major part of the population, they should be under care. Care from the standpoint of governmental intervention. The health situation definitely demands improved care from the mother. Now, in this area, 15 to 24 years, they should be taken together under the care of different institutions which are specified for mother and child care. Now, if we go further, if we compare the situation, we will see in developed regions, if we consider the maternal mortality pattern, the thing will be clear. We have ample scope to improve in this area. Now, in developed regions, particularly Europe and North American regions, and in our area, particularly Japan, that is in Asian area, they together constitute 12 per 1 lakh live birth maternal. Now let us see what is seen in developing regions, particularly Indian subcontinent. 239 for the same number of lives, that is in 1 lakh live birth, 239 are mothers are dying. It is the condition, and this should be taken into consideration. Region to region variation is extremely important because governmental program will be changed and will have to be taken into account considering this thing particularly. Now, if we see the picture of a nation in African region, that is Sierra Leone, here MMR is 13,060 per 1 lakh live births. It is the data from 2015. And it should be also mentioned that Nigeria and India together account for over 1/3 of the all global maternal death in 2015. So, the government of Sierra Leone has the obligation to give highest priority to maternal health. Country like us, we are not in a very good condition. 2015, in the maternal mortality rate in India is 174 per 1 lakh live births. Now in Pakistan, our neighboring country, it is 178. Bangladesh, 176. If we go to Sri Lanka, the thing is very different. Here they have improved much and 30 per 1 lakh live births. Now if we go to developed countries, let us see what is the picture. In Japan, it is only 5 per 1 lakh live births. In UK, it is only 9 per 1 lakh live births. In USA, it is only 14 per 1 lakh live births. On an average, it comes to 12 per 1 lakh live births in developed region. Now, this should be taken into consideration because the health care pattern, in particular, when we are considering the policy of the government, these figures should be taken into account. In developed regions, now they are focusing to cardiovascular diseases, stroke, overnutrition, obesity, and all these things. Definitely metabolic disorder, hypertension, diabetes, they are taken into account in developed regions, and it should be very clear that diabetes is also going to be a major problem in our country. But we should not forget that maternal mortality in our country is 174 per 1 lakh live births. Now in private sector, the whole healthcare delivery system is focused on cardiovascular, cerebrovascular disease, cancer, metabolic disorder, nutritional problems, dermatological problems, all these things. The private sector, they are not taking the share of the responsibility in improving the health care, it should be taken into account that in metropolis particularly, the development of huge number of private hospitals are taking care only these diseases, that is cardiovascular, cerebrovascular, malignancy and all these things. Now when you are going to the problem related to childbirth and maternal mortality, definitely the whole care system is dependent on government. And in the developed regions, government had already performed in a far better way so that maternal mortality is remarkably less. In our country particularly, we have the obligation to focus on maternal health, and definitely child health as mother and child is singular. Now we can proceed. Okay. Now let us see the infant mortality. Okay. I think you can see here, that is the infant mortality rate is selected country 109, 1990, 2015. Okay. Now let us see in India in particular. In 1990 it was 88 infant mortality. In 2015 it is 38. We have improved, and definitely we can compare it with Japan, and you see that it is 5 and 2. And in world situation 63, 32. Okay. Infant mortality is another parameter which focuses to health care delivery system, and definitely we are lagging behind. Mother and child, as we take it as one unit, the whole care system should be focused and should be oriented in a manner so that mother is getting highest priority in this field. Simultaneously, if we take care of the mother, the child will get the care and the definite the share of the whole care system automatically. In our government hospital, definitely mother and child in higher centers, particularly in medical colleges, particularly, we have the setup so that we can take care. But in peripheral, particularly in rural area, the problem if develops after childbirth, say for example, if hemorrhage develops in case of the mother, from the peripheral region, we need to shift the mother. When we are shifting the mother, definitely a larger section, a larger portion of them are not getting proper care and dying on the way or not reaching in proper time. Now comes the question of the infant. The same problem develops in case of infant. Now a low birth weight baby has taken birth in a peripheral center. Suppose the infant has developed some respiratory distress after birth. The whole healthcare delivery system is not much equipped to give a neonatal support system to the infant in any peripheral area. They can only give a kind of primary care. The improved healthcare delivery system, which is urgently needed in these situations, are not available in most of the areas of our country, and definitely the rural areas, the hilly areas are highly neglected in this respect. So it contributes to infant mortality, and it also contributes to maternal mortality. Let us see what happens in the next slide. Okay. Now, infant mortality, female literacy rate, and birth rate in major Indian states. Let us see what is happening. The chart is large. We do not need to go through everything here. Okay. Let us see. Particularly, I have pointed out that is Kerala and Madhya Pradesh. In India, particularly, the difference is wide. Infant mortality rate in Kerala is 12 per thousand. Now let us see what is happening in Madhya Pradesh. It is 52. Female literacy rate, 2011 value, 91.98 in Kerala. In Madhya Pradesh, it is 60.2. Birth rate per thousand population. Okay. Let us see in Kerala, 14.8, and in Madhya Pradesh, 25.7. One thing will have to be very clear that female literacy has a definite role. So the healthcare system is integrated, is actually related with the other system. That is definitely education is very important. If the mother is educated to some extent, the child definitely gets improved care. From the data here, it is clear that in Kerala, where female literacy is high, infant mortality is low. It has been clearly delineated in other countries also. Different parts of the globe focus the same picture. Unfortunately, if we take healthcare system as a separate unit, it is unlikely to work. It will have to be integrated with other systems also. Definitely income, definitely literacy in general, and female literacy in particular is very important. If we take care about the literacy campaign, if we can educate our improved healthcare, and definitely birth rate will also be low, because the mother who is educated has a role and has a say in forming the structure of the family. If she gets priority, if she gets the chance to share how they will build up their family, definitely the family will improve and childbirth will be controlled. Spacing of childbirth will be controlled. How much childbirth should be deferred will also be decided through the participation of the mother. Now, mother and children not only constitute a large group, but they are also a vulnerable or special risk, which is already very clear. Because if we see to the general pattern of disease, we have seen that the pediatric group is extremely susceptible. Now, after birth, the infant is very much vulnerable, and in infancy, different types of infections are very common. It is due to lack of proper immune development. For the development of the immunity, already a program is running, that is vaccination program against 9 diseases. Definitely we know that polio vaccination, vaccination against tuberculosis meningitis, it should be clear that the BCG vaccination which is done just after birth, it is definitely known, almost nowadays it is almost known to everybody that a vaccine is given after childbirth, and that is the BCG. Now, it takes care of the tuberculosis meningitis in particular, and it should be clear that this is not taking care about the pulmonary tuberculosis. Pulmonary tuberculosis is very high in India subcontinent, and it is not the BCG which is giving any protection against this particular form of tuberculosis. So we are taking care in case of this particular vaccine, with this particular vaccine, tuberculosis meningitis. Now comes polio. I think everybody is already well aware of the oral polio vaccine campaign to eradicate polio and all these things which is happening. That is definitely uh, very clear. I think it needs no much, not at all much discussion. Oral polio vaccine is there. Now comes triple antigen, that is DPT, diphtheria, pertussis, and tetanus. And after that, we come to measles. Now these are 6. Now already 3 has been added here. That is hepatitis B has already been included. Definitely it is there, and we are already know. It is known to us that uh, encephalitis, and definitely encephalitis has already been included, and HIV, Haemophilus influenzae infection. These 3 has been included. Another thing which should be taken into account, that is German measles. It is a very different type, and these German measles has the potential to cause definite damage of the fetus. That is the child in utero, what we call the fetus. If the mother in early pregnancy is infected with German measles, which is not uncommon. In developed regions, it was seen, and already vaccination has been clearly done there. We are also proceeding towards that. Though MMR has not been included in the government strategy, that is measles, mumps, and rubella. That is, rubella means German measles. This rubella is available in private clinic, from private clinic for female child particularly. This rubella vaccine is very important. Now, if we give MMR, definitely for the girl child, rubella infection is prevented, and a large section of anomalous development of the child, particularly certain kind of congenital heart diseases, a kind of eye problem, that is cataract, and some other problems which may develop if the baby in utero, if the fetus gets infected from the mother with germ. It is a very insignificant infection, not clearly known by the mother, just a low-grade fever, sneezing, cough, and definitely one ignores. But it may be German measles. And in this condition, if the mother is bearing a child, the child is under serious threat of getting this type of infection, which may give rise to definite type of problem, particularly congenital heart disease and etc. Okay. Now, in case of one thing is very important. There is a risk which is connected with childbearing in case of women, in growth, development, and survival in the case of infants and children. Okay. In the case of survival, we have already known because infant mortality is a phenomena which is pointing to survival, definitely. Now, infant and children have a problem with growth. Particularly, brain development is very important. In early infancy and early childhood, very sharp rise of brain development occurs. If this period is neglected, if in infancy and childhood there is undernutrition and it goes on and on, definitely there will be a problem which is related to the intellectual capacity. In future, for school, for intelligent work, the child may lag behind. It should be kept into account and to keep it under observation, government has already taken some measures. If we can really go through the chart which is given by the government institutions to the mother for the care of the infant and the children up to 5-6 years, we will see we have chances of going to the centers more than 50 times within 5 years. If we can really reach there, if the mother can really reach the center with the child, definitely there will be improvement. Every month, one should see for the weight of the infant and the child. The growth pattern will be clear. In the chart, there are boxes where the health worker will give you the chance to point it out, and a line will be drawn, and everything will be clear whether your child is getting clear development or not. Now, in case of the mother, particularly childbearing is a risk area. There is 9 to 11 kg weight gain on an average. Now, if the mother is undernourished, definitely the child will be undernourished and the development in utero will not be proper. In our area, in Indian subcontinent, there is in the underdeveloped regions, particularly in rural regions, 5 to 6 kg or 7 kg weight gain is there, and it points to a particular area that the child is not developing properly. So, with in fetal condition, if the mother is constantly under threat of undernourishment, definitely in utero, the fetus will not develop properly, and definitely after childbirth we will see a baby undernourished and the crisis develops. In this area particularly, if the mother is undernourished, there is risk of the mother from the standpoint of normal health and survival. Now we have already come to this point. From we commonly accepted indices, we have seen many other indices are there. We are not going to discuss in details. We don't have that time. We have seen literacy, infant mortality, maternal mortality. It has already been clear that the infant, child, and maternal mortality rates are high in many developing countries, including our country. It is already clear. Now, if we come to here, much of the sickness and deaths among mothers and children is largely preventable. Let us go to a particular point. There is a scheme of distributing mother folic, that is iron folic acid to the mother. If we can do it properly, definitely anemia will be prevented. If we can take care about infection, definitely mother will go on with pregnancy in a proper way. And definitely deaths are there due to unwanted infection, unhealthy living condition, very poor sanitation. In urban area also, in slums, the condition surrounding the mother is such that it is extremely difficult to avoid any kind of infection. So we will have to do something in a different way. It is not a question of distributing medicines to the mother. It is a question of providing her a proper place to live, a proper environment where she can live a healthful life. A small room packed with many persons, with many other children, parents, and a corner is fixed for the mother. No, it is not at all desirable. And in our country, unfortunately, some dwellers and in rural areas also, they are bound to accept this situation and they are prone to definitely different types of infections, which is giving rise to maternal mortality. Definitely, the general population, as such, what we are telling, if we improve health of mothers and children, we contribute to the health of the general population. I think it has nothing to say anything more because it is already clear. If we can reduce infant mortality, maternal mortality, under 5 mortality, if we can improve the health of the mother and the child, general population will improve because male, female alike, if the children under 5 are taken care and infant mortality is reduced, their normal health is maintained, infection is controlled, they are going to be good from the standpoint of health. Okay. Now, these considerations in our country, unfortunately, formulations of special health services for mother and child all over the world, but it should be taken into account that in developed regions, the schemes are a bit different. In developing regions, they are definitely uh, getting priority, and the area which is covered in developing area need not be covered in developed regions. They are taking care of some other problems. Sometimes in case of overnutrition and all other things, marital age or childbearing age in developed countries, sometimes it becomes a very high age, higher age group. But in our country, not in our, but lower age is very important. Early marriage is very widely seen. There are some prejudice, some religious, some ethnic problems, caste and all these things. Marriages are directed not from the standpoint of any scientific angle, from the standpoint of some well-established superstition, prejudices, that is, some cults, some cultural barrier are there. By overcoming, we will have to overcome all these obstacles. And the health services have been now the special health services, which has been taken into account, looking into these problems. We have problem with some taboos. We have problem with some superstition around these things. So we have taken into account one thing, that is Millennium Development Goal. And United Nations 191 countries have taken these into account. Now, if we go through the health service pattern, we will see the whole service pattern, which is particularly formulated for mother and child, has been rest on government service only. But in urban area, the availability of government service, whatever it may be, Middle class and upper middle class people are reluctant to take this type of service. They largely go to the private sector, and definitely the care system a bit different, which is not actually coming into the purview of our discussion at present. Okay. Mother and child must be considered, as we have already taken it into account, and definitely it is one unit. We cannot separate it. If it is separated, unfortunately, definitely we will see many other problems are going to develop. And we should take into account that when we are going to take in the mother under care, we are bound to take the child under our observation. It is already clear the healthy mother brings forth a healthy baby. Certain diseases and conditions of the mother during pregnancy are likely to have effects upon the fetus. It will have to be taken into consideration, particularly germ disease. Now there is another kind of problem, which is substance abuse. Nowadays we see different types of substance abuses, that is some kinds of addictions, particularly if the mother is alcoholic, if the mother is smoker, some injectable drug abusers, definitely the fetus will have its effect. If the mother takes this type of drugs particularly, the fetus may have some deleterious effect upon its brain development and some organ development. We know already the case of Japan. At the same time, thalidomide disaster that is seen not now in 50s and 60s in European countries still lives. Particularly using a particular drug, it has been seen that the infant is seen with short limbs, defective limbs. And when it was investigated, it is found that thalidomide is causing the havoc. For this reason, after 50s, 60s, thalidomide is totally banned from any kind of use in medical domain. Nowadays, we are using many drugs. Actually, the effect of all these drugs are not always very clear. We should be very serious about one thing. During pregnancy, one should avoid using any drug which is formulated from unknown area in television. Nowadays, drugs are advertised and it is prescribed through television that you take this, that, and all these things. Without knowing details of composition, without discussing the attending physician during pregnancy, mothers should strictly avoid use of any kind of drug. Now, in case of hypnotics, sedatives, and many other drugs, in case of many metabolic drugs which are modifying metabolic effects, mothers with diabetes who will have to take some care from the standpoint of their blood sugar control and all these things, this should be under strict supervision of the doctor, and definitely it should be taken into account that each and every time when the mother comes in contact with the doctor, minimum 4 contacts should be there. If we get 7 contacts, now actually as a rule, after 12 weeks, one should go monthly, each and every month up to 7th. On 8th month, one should go twice in a month, and at the 9th month, once in a week, one should go. The mother should go for checkup. But if it is not done, at least 4 checkups should be taken. Nowadays, we have the scope of detecting anomalies. So, in this case particularly, if there is anomalous development suspected in case of pregnancy, in early pregnancy, you can detect there is scope of termination of pregnancy. We must take into account about the development of thalassemia and related hemoglobinopathies. These are the problems which are coming. And definitely, if we can detect early, we can terminate a kind of unwanted pregnancy. It should be very clear that different types of formulations which are not prescribed by doctors but are under huge advertisement area should be avoided. Now, if the mother dies, the child may develop maternal deprivation syndrome. If the mother is uh, not there with the mother dies, definitely psychological and other nutritional development of the child is hampered. And it is a large area. We are just focusing on this and not going in details. Now, it should be very clear that mother is the first teacher of the child. Now, here we end. Mother teaches the child. If there is any deprivation, definitely the psychological development is hampered. If the mother is healthy, is able to live with the child peacefully and joyfully, definitely the child will have a good physical and mental development. We must focus on this. There may be broader area of discussion. In this time, we don't have that scope, so we conclude. Thank you all.
হ্যালো, আমাকে লাইনে দিল কিনা বুঝবো কি করে রাজু?
Yes, sir.
Hello?
You are বলুন স্যার। স্যার বলুন।
হ্যালো, ওকে
শোনা যাচ্ছে?
ওকে, am I audible?
Yes, you are audible.
Okay. Thank you, Dr. Gishpati Chakraborty. From the participants' end, there are few questions raised. We will discuss that question in the interactive session. Now we are going to start our webinar session 2, where our respected speaker, Dr. Anindita Ray Chakraborty. Before going to start the session, I would like to say something about Dr. Anindita Ray Chakraborty. She is an assistant professor and head of the Department of Nutrition, Moharani Kashishwari College under the University of Calcutta. She has completed her graduation and post-graduation from Calcutta University, ranking first in both the examination, and is the gold medalist and was also a topper in the college service examination as well. She has done her PhD from the University of Calcutta and worked extensively on diabetes and medicinal plants. She has authored 4 books on food and nutrition and had several national and international publications in journals like the British Food Journal, Journal of Food Microbiology, and many more. She is currently carrying on a postdoctorate research with International Rice Research Institute and British funding. She is a prolific speaker in the several scientific seminars and chairs many such sessions as well. She works in community projects and is an invited expert in food and nutrition board and other government and non-government organizations. She is a consultant nutritionist for many food institute. She is a popular face on several television channels and also on radio talk shows. As an expert on nutrition and dietetics, she is also an advisor and consultant for various food companies. Now, may I request to Dr. Anindita Ray Chakraborty proceed this session.
Thank you so much for this lovely introduction, Manjur. I thank the entire team. I think I'm audible. I'm audible?
Yes, ma'am. Yes.
Yes, thank you.
Clearly audible.
Yes, and the slide is also visible, I'm sure. I
Yes,
hope.
yes, ma'am.
Okay. So thank you so much for this lovely introduction. And it was a pleasure immensely to hear Dr. Chakraborty take such a wonderful session. And in fact, he has laid the ground for what I am going to say. In fact, the webinar that has been planned by the team, I think this is the apt time for this, the correct time for this. We are all concerned with the corona crisis, but we have forgotten the center of attraction, that is the woman. You must have all wondered that nature nurtures, and maybe that's why we call her Mother Nature. The earth houses us, the earth cares for us, protects us. So probably that's why we call her Mother Earth. And thus, when life is to be born, I'm sure that is the reason where a woman is considered. So you must all by this time you must have understood that how important, how significant a woman's role is. She is a mother, a daughter, a caregiver, a sister, in all her roles that you see here, in all her roles, she is a caregiver, a supporter of life in all cases. So naturally, you must understand that it is central, it is very important that we give her the utmost care that she deserves. Now, to share some alarming facts, Dr. Chakraborty has already said, as I said, he's laid the ground already for my lecture. Some very alarming facts. I think you can also see my arrow on the screen moving. 33% of the women in the age group of 15 to 29, they are malnourished. Just imagine, 33%. It's a very big figure. Every third woman in India is undernourished. Just imagine. And every second woman is anemic. This is according to the census 2011. The next census, I sincerely hope that we can change these statistics by the next census. You see, 88% of the adolescent girls are suffering from anemia. The calorie requirement that a woman needs, a calorie requirement, is 80%, less than 80%. She's getting less than 80% of her energy requirements. Just imagine the kind of requirement she needs and what we are giving her. So this is the reason why women's health deserves a special place in the community, deserves this webinar and many more webinars and many more discussions, so that the millennium goal that was set would be fulfilled. Now, before I pass on to the nutrition part of it, I will obviously highlight on the nutrition part because Sir has already said about the health part, mainly clinical part. This slide is very interesting. The interaction, as he was saying, the mother and the child as a single biological unit. This picture says it all. You can just follow the arrows and you can see that a woman who is malnourished, a woman, the house where the child will develop, where a baby is born, where the future is set, is malnourished. If she's malnourished, then the baby would be of low birth weight. A low birth weight baby would be a stunted child. Now, if you ask me what happens if a child is stunted, I would say that the child will have reduced mental capacity, reduced physical abilities, and will grow on to become a stunted adolescent who would also have reduced physical, mental, cognitive ability. By cognition, I mean thinking abilities, the ability to understand. So naturally, you see this entire interaction is very, very important. And finally, we will again have malnourished women. So you see this vicious cycle where a woman and a child, and again a woman, is connected. This vicious cycle has to be broken. And for that, we need proper nutrition as a central point. Obviously, other things are there, but I will be highlighting on the nutritional aspect. There are various nutrients that have to be considered, but I have picked and chosen a few of them due to the time of set. And I will talk about the single nutrients, yes, the single nutrients, obviously, but also the interactions. There are interactions that are there in our body which help us to actually have a proper metabolism that will give us sound health, sound physical health, sound mental health. Mental health is a very, very important consideration now, presently, because a lot of depression, I will also talk about depression, you will see. So, vitamin D is of utmost importance. Why? We all know the first thing that comes to our mind when we are talking about vitamin D is bone health. But we forget that vitamin D is also related to, bone health, I was saying, is also related to brain health as well. It is no longer considered a vitamin, but it is considered a hormone, more a hormone than a vitamin. There are several reasons for that. And you must understand that vitamin D in tropical countries, we stay in a tropical country, we were very happy that we will never have vitamin D deficiency. We always thought that, we believed that. But please get yourself tested. Male, female, we all suffer from some kinds of vitamin D deficiency, some stages of vitamin D deficiency. The reason being that the sunlight of the wavelength 270 to 300 nanometer is responsible for the vitamin D synthesis in our body. We were very happy that vitamin D is being synthesized, so we do not need proper food. No, you're wrong. This synthesis is, number one, not adequate anymore. The pollution all around is reducing that synthesis. The food sources that you see here on the slide are supplying very less amounts of vitamin D. They don't have a huge uh, abundant source of vitamin D. So what is happening? The vitamin D metabolism in our body is being hampered. I'll just slightly go into the physiology, the regulation, how vitamin D is regulated in our body. See, the sunlight that is falling on the skin, as I mentioned, 270 to 300 nanometer, that particular specific wavelength of sunlight is responsible for the synthesis of vitamin D. Obviously, diet is also there, obviously, but diet does not, I repeat, diet does not form a significant part. No. When vitamin D is first, when sunlight first activates the dehydrocholesterol, a little scientific maybe the term is, but for the students who are there, I'm sure it will be a good information for them. The 7-dehydrocholesterol on the skin gets activated in the liver first at the 25th position, then goes to the kidney for hydroxylation at the first position, and then back to the liver again for 24th position hydroxylation. To make it a little less scientific or little less nutritional, as I would call it, there are 3 hydroxyl groups added to vitamin D, and only then calcitriol, tri as in 3 and all as in the OH groups, are added, and vitamin D can then become active. You see the functions, you can see it on the slide, the functions that vitamin D performs, the bone, the muscles, the intestine, everything is interrelated. As you can see, there are different levels. I was saying there are different levels of vitamin D deficiency. This is just the insufficiency part, 25 to 50 nanomoles per liter. Insufficiency, just the beginning. So if you get yourself checked and if you see that you're within this range, you will have to be careful. Start being careful. Less than 25 is deficiency, definite, and less than 12.5, you will have the alarm is raised and you will have to be very, very conscious. So, and please remember, I will show you that vitamin D deficiency, I'll just go back to the slide, is related to depression. Mind you, vitamin D now is no longer considered a vitamin only. It is also a hormone, can regulate certain functions of the DNA. I'll not go into the detail, and it can affect the mental status, the serotonin secretion, and a lot more. So it is related to your mental health, your well-being. The mineral that comes to our mind as soon as we talk about vitamin D is calcium. Calcium food sources are abundant. Again, milk and milk products obviously supply huge amount of calcium. Nuts and oil seeds. So if you're not very much bothered about your weight, you can obviously consider having some amounts of nuts and oil seeds in your diet so that you will get a good amount of calcium. Now, calcium obviously is responsible for bone growth, as you can see, bone growth and maintenance. As I was talking about interaction, I'll show you the slide. Calcium also helps in muscle contraction, blood clotting, nervous signaling, and obviously some hormonal interactions. Please remember, I've just highlighted these two age groups, not age groups, I would say physiological conditions, pregnancy and lactation, where calcium plays a very, very significant role along with vitamin D. You see, because we're talking about women's health. Please remember, calcium is also important for other categories, obviously, for males, for children, everyone. But since we are highlighting on women, you see the kind of diseases that go and are related to calcium and vitamin D deficiency. The word osteo here is bones. Osteo means bones. Malacia is softening. So there is bone softening. Porosis means porous. The bones also become porous. There's a lot of pores in the bone. So you can see from the slides, the osteoporosis, there is weak nails. Dermatitis, derma is skin infection, dermatitis, skin infections, heart problems, tooth decay. So many things related to calcium and vitamin D deficiency. Now, only calcium or only vitamin D will not help. There has to be an interaction. Now, what is that interaction? That interaction is that calcium, the calcium here along with parathyroid hormone, these are all interrelated. You can see the interrelation. I will not talk about the entire mechanism, but this is basically the interaction that takes place between calcium, phosphorus, and vitamin D. Please remember, calcium and phosphorus, they actually have a synergistic role, and the ratio of calcium is to phosphorus is 2:1. That is very, very important. Now, the next thing that comes to our mind always when we speak about a woman is iron. Iron is present in food items like green leafy vegetables. It is present if you're a non-vegetarian. You should be happy that your food source, your diet is full of iron because you're having meat, fish, eggs, etc. But obviously, non-vegetarian sources, like plant sources also, are very, very rich in iron. And iron helps in the first thing that comes to our mind is the red blood cells. The red blood cells are produced, and the antioxidant balance is maintained also by iron and vitamin C. You again see the regulation, the interrelation takes place. In fact, vitamin C helps to reduce iron in such a way that it can be better absorbed in our body. When iron is reduced, vitamin C is a reducing agent. It is an antioxidant. The iron reduction that takes place from ferric to ferrous increases the iron absorption. So the interaction between iron and vitamin C will help in a long way. Now, iron deficiency, we all know, is related to poor oxygen supply to our bodies. It will lead to weakness and tiredness because oxygen helps in energy production in our body. So if there is reduced oxygen, if the oxygen carrying capacity of RBC, red blood cells, is lowered, so what will happen is we will not get enough energy. Now, as I was talking about interactions, iron alone cannot help. It has to be iron, folic acid, and vitamin B12 together, which form a package that can actually help you to protect against anemia, the main deficiency symptom. In this context, I will have to mention, and I should mention, that folic acid, vitamin B12, they are related to the homocysteine. Homocysteine is an amino acid. This homocysteine level becomes very important for heart health. Homocysteine is related to cardiovascular health, and nowadays the increased level of homocysteine is one of the indicators that can show you that you're at an increased risk or an increased risk of cardiovascular diseases. So now folic acid, vitamin B12, and iron have been shown to interact amongst themselves to carry out all these metabolic pathways that actually help us in the process. Another as I was saying, that single individual nutrients are not able to function in our body. They will have to be, there are different types of interactions that take place. For example, vitamin E and selenium, this interaction also sets a very important antioxidant balance in our body. Now, selenium, we don't talk about selenium much. You must understand, we don't talk about selenium much. Instead, we generally talk about the vitamin E status. We are more concerned with vitamin E. But please remember that vitamin E and selenium together form an antioxidant system where they interact with two more enzymes, glutathione peroxidase and glutathione reductase, which can actually help to maintain the balance. We women are very, very concerned with vitamin E because it helps in the skin status, maintenance of hair, and so on and so forth. So please remember that only vitamin E, but not only vitamin E, but selenium also plays a very, very significant role. But please remember, I must mention that vitamin E is a fat soluble vitamin, and naturally, this fat soluble vitamin, if taken in excess, will be harmful. So please, I will show you the RDA chart. Please stay within the RDA chart of vitamin E requirements. Now for the antioxidant status, this is a very colorful chart. This is a very colorful chart. I'm sorry, I just slipped. This is a very, very colorful chart. I have already mentioned antioxidants in different respects. Vitamin E, I've talked about. Vitamin C, I have talked about. These are all antioxidants. So why am I showing this slide again? Now, other than these vitamins, there are some other antioxidants that Mother Nature has blessed us with. See, the yellow orangish color of turmeric is curcumin. That is an extremely, in fact, if you go see journals now talking about antiviral effect of turmeric, I'm sure you must have heard. Antioxidants scavenge the free radicals, eat up the free radicals in our body, and actually protect us against cancer, diabetes, PCOD. Why PCOD is important, polycystic ovary disease? Because it is a very, very important and crucial symptom nowadays in most of the women. I'm sure, sir, Dr. Chakravarti will agree with me that there are so many women coming in with PCOD conditions. So naturally, turmeric plays a very, very significant role there. You can see these elderberries, blackberries, violetish color, anthocyanins, flavonoids. These lycopene, red color is lycopene. So these entire antioxidant bundle, I would say, protects the women's health. Day in and day out, she's working, and this protection can be given by these antioxidants. To put it a little lightly, if the flavonoids form the police force, just a slide for the students. Selenium is the chief executive. Selenium obviously interacts with vitamin E, as I already said. Vitamin C is the special force that works with the police. Carotenoids is the vitamin A component. It is also an antioxidant. And vitamin E is the headquarters, which communicates with all of the components. And the antioxidant balance and our gene expression is the Ministry of Defense, the main head office, which is the main center, which is actually sending out the signal. So if we can actually remember these antioxidants and these interactions, then a women's health that is facing challenge day in and day out will obviously be protected, well protected. Other than antioxidants, there are several other functional foods. Like functional foods, I mean, they are not generally belonging to any category, but they actually detoxify the body. Like omega-3 fatty acids. The very word fat, when we hear fat, we think it is bad. But no, there are good fats as well. So omega-3 fatty acids are there. phytochemicals. Phyto means plant chemicals. These are very, very important. Garlic, cinnamon, they have been proved to be antibacterial. And now extensive research is being done. If you just go through the journals, you will see that they have antiviral effects as well. That is the need of the hour, obviously. This chart just simply shows the variety of foods and the amount that you should be having. You can see the whole grains form because it has been taken from a foreign paper. So naturally pasta has been added. We don't use it, but just concentrate on the whole grain. See, it forms the broadest area in the pyramid. Then fruits and vegetables is the next part. And gradually as we go up, see the meat section has taken up a very, very small portion. So this is a pyramid, a balanced food pyramid, which you should remember while choosing your food in the daily diet. So this is basically, and please do not forget the 6 glasses of water recommendation. As I told you that I would show you the RDA chart. Now, the RDA chart in India is formulated by the Indian Council of Medical Research, and NIN, National Institute of Nutrition, does it under the ICMR guidance, of course. This is a very big chart. Just concentrate, because we're talking about the women's health and women's nutrition. We will just concentrate on the women part. You can see the sedentary, moderate, and heavy working categories. So a woman who is a sedentary worker, who does not have a very high physical activity rate, has lower calorie, about 1900. Someone who's working moderately is 20 to 30, 2230 kilocalories per day. These are obviously on per day basis. And for heavy workers, it is 2850. These are the normal values. And if she is pregnant and if she is lactating, you can see the difference. The age groups have also been specified. For girls, different age groups have been specified, and also boys have, it's the ICMR chart. So the mention of boys would also be there. To highlight on pregnancy and lactation, the plus signs that you see here, the plus signs that you see here are basically the extra, the additional values that are needed. And for lactation, for the first 6 months, the extra calorie is 600, the protein is 77.9. And for the next 6 months, it is 520 extra. Now, you would obviously wonder why in the next 6 months the lactation, the energy requirement is lower. The reason behind this is that this 520 is because the child is already weaning. He or she is having weaning foods. So the calorie requirement of the lactating mother goes down slightly. So this, and we are coming up with the World Breastfeeding Week, the first week of August, I'm sure we all know that. And naturally, we will have to draw our attention or focus our attention on this particular category of females. Now, we were talking about the nutritional values, the nutritional requirements. We would also have to remember the associated problems. So just to focus on a few of them, we have already spoken about anemia. We have spoken about undernutrition, but obesity in our country also in the middle and upper middle class families is alarming. In fact, our country has seen both sides of the coin. One side, there is obesity leading to diabetes, heart diseases, cancer. And on the other side, there is undernutrition giving rise to undernourished children, and the entire future of the nation is under challenge. But something that you might not, my premenstrual syndrome will always be there within that age category where a woman is is having the menstrual cycle, of course. This is less of a nutritional disease, but the others are. And the most important diseases that I will just highlight upon are anorexia nervosa, bulimia nervosa, and binge eating. Why am I talking about these 3 diseases? Because these 3 diseases are so important from the standpoint of adolescent girls, especially even in our country, because they are very concerned with with their looks, with their weight. So what are they doing? They are actually stopping the intake of food forcibly. See, an anorexic, these are very, very complicated nutritional diseases. And a woman has to understand that beauty is from within. She does not have to go, because we encounter so many young girls, so many students who are falling into these categories of anorexia. They forcibly go on a diet regime that is hampering their body. Bulimia nervosa, still more difficult to handle, because the woman would eat and then purge. You can see the vomiting so that the calories are not absorbed. Just imagine. So these are the problems that a woman has to understand, that the nutritional balance of the body is being disturbed significantly, and these can be stopped. Malnourishment is obviously a challenge that has to be handled socially, economically, and obviously otherwise. But these are the factors that we can do something about. So, finally, to conclude, that a woman's health is not just her health, it's the health of the entire nation. And improving one woman's health means improving the health of the entire family, communities, society at large. And just to sign off, so that just to leave a message, the hand that rocks the cradle rules the world. Strengthen and empower it to make life complete, because it is the hand that guards the future, as you can see in the picture. So give her enough to eat, a mother, a caregiver, and so much more. She creates the world, the entire human race. A balanced diet can pave the way for holistic health, and this will build the future and make the world. I'm sure it will make the world a better place. Well, thank you so much. I hope I could uh, tell you about the interactions, the complex interactions that take place in the female body, and hope by the next census, as I was saying, we will have better statistics. Thank you so much.
Thank you, Anindita ma'am,
Thank you so
for
much.
your valuable, wonderful talk to cover the all dimensions of the nutrition, diet, and women's health. There are many questions
Thank you.
pointed out from the participants' ends. So first, we wanted to know the answers of the questions raised on the session of Dr. Rishpati Chakraborty. There are many more questions, but within this time, we try to at least 2 or 3 important questions.
Okay.
Sir, one participant wanted to know,
Exactly.
during pregnancy, use of mobile phone, is it good for health?
Okay. I'm coming. Now, first I want to congratulate Dr. Anindita Rai. Really, the lecture is moving. I am
Thank you so much.
really, it is such, and really I came to know so many things. I would be very happy
Thank you. It's an
to,
honor. It's an honor.
yes, definitely, to meet you in future. If I need any help from you,
Absolutely. It
definitely
will
I
be a
shall ask.
pleasure and an honor. Absolutely, sir. Absolutely.
Okay.
Thank you so
Now,
much.
I am going to the question, particularly regarding the mobile phone. Okay.
Yes.
I would like to point you
During
out, during pregnancy, the use of mobile phone.
use of mobile phone is good for health.
No, it is one
Yes.
thing, it is very important, and the one thing, another thing which will be pointed out, actually, the study regarding the matter is going on. Concludingly, we have not come to any particular area. Neurological development and all these things may have under threat, but we are not at present very sure from the scientific standpoint. It's strict uh, discussion. Next.
Okay. Next question by Ritika. In this present situation, many children are not allowed to take their timely vaccine or injection from many families. How I help them to get rid of this situation?
Definitely, it is very important. And one thing I must tell that mobilize a family towards vaccination is a matter of counseling. one will have to give a visit, home visit. That is, in our area, there is a scope of home visit from health worker. If required, the doctor will have to go reach the family and will have to address and definitely look for the questions, what are the obstacles before them, why they are not interested. If it is so that they have some prejudices and some wrong idea about the vaccination, it should be clearly explained. And if it is not done, definitely we are unlikely to be successful. One thing, my experience, I tell you, in one area in Burdwan, one mother told that vaccination may be equal to sterilization. It is something very curious. I asked her that who told you? Oh yes, I came to know all these things from any place. Now it is some superstition and all these things which are acting. It is better to reach and counseling is very important.
Another one questions by Shohini, what is catch growth of a baby? Catch growth.
Okay, it is better if she explains what she is actually wanting to know. That is, one thing is very important. That is, a baby is seen after birth every month. For if we strictly follow the rule, we will see in the chart the real development from the standpoint of weight, height, all these things. And mental development is another area which is addressed after some time. Initially, we see for the physical development. After certain time, we see for mental development. They are different scales for this. So, if
Okay.
she clearly and definitely, if she just explains in what area she is trying to focus, it will be better. Next.
Okay, thank you, sir. One more question. How can we prevent dental problems in children?
Okay. Now it is a nowadays it is a problem coming from chocolate and definitely chocolate, pizza, and different types of foods which are junk foods. And the very important one thing is one will have to have the habit of washing mouth properly after taking of any food which contains sugar, because it helps to the growth of bacteria, and under bacterial growth there is some acid secretion, and due to the acid the enamel of the teeth is destroyed, and definitely that tooth is loosened out from out of socket. For this reason, to brush at bedtime and each and every time after taking, particularly sweetening and all these things, sweetener, sweet foods, one must have good and proper washing of the mouth. And definitely calcium rich food is very important if there is dental caries. And another problems are there, fluorosis, it is not in our domain. If asked for in future, I shall go.
Okay, thank you, sir. Our principal, sir. বাবু প্রিন্সিপাল স্যারকে লাইনে দিন। একটা প্রশ্ন একজন পার্টিসিপেটস করেছে যে মা ও সন্তানের স্বাস্থ্য ও পুষ্টিতে সমাজে ও সংসারে নারীদের দৃষ্টিভঙ্গি ও ভূমিকা আমরা জানি। মা ও সন্তানের স্বাস্থ্য ও পুষ্টিতে সন্তানের নারীদের ভূমিকা আমরা জানি, শহুর এলাকায় তা কতখানি সদর্থকভাবে পূরিত হচ্ছে? আপনি যদি একটু অভিজ্ঞতা শেয়ার করেন।
প্রশ্নটা আরেকবার বলো, আমি আমার যদিও আমি জানি না আমি এটা উত্তর দেবার পারি, প্রশ্নটা
মা ও সন্তানের স্বাস্থ্য ও পুষ্টিতে সমাজে নারীদের দৃষ্টিভঙ্গি ও ভূমিকা কতখানি গুরুত্বপূর্ণ সকলেই জানে, শহুরে এলাকায় তা কতখানি পূরিত হচ্ছে?
এখন প্রশ্নটা যেটা হচ্ছে, তার মানে শহরে কারা বাস করে, কি ধরনের মানুষ বাস করে, মানে সেটা সম্পর্কে একটা সম্যক পরিচিতি দরকার। শহুরে এলাকাতে আমরা দু ধরনের মানুষের, মানে যদি ডেমোগ্রাফিক্যালি দেখি বা তাহলে আমার মনে হয় শহরের একটা অংশ থাকে একটু উচ্চবিত্ত মানুষ, যারা শিক্ষা এবং হচ্ছে খাদ্যের যে মানে ভাগের দিক থেকে দেখি, তারা তাদেরকে বেশি পায়। এবং যদি শিক্ষা বেশি থাকে, খাদ্যের যদি যোগান বেশি থাকে পরিবারেতে, তাহলে সেখানে যে মানে ভাগাভাগিটা কম হয়, এবং এবং হচ্ছে মা বেসিক্যালি সন্তান একটু বেশি পায়। কিন্তু শহরে আবার হচ্ছে যে প্রদীপের নিচে অন্ধকারের মতো, শহরে কিছু স্লাম থাকে, যেখানে কিন্তু যে মায়েরা তারা এমনিতেই সংসারে খাদ্যের নয়, তাই মা এবং সন্তান তাদের খাদ্যের ঘাটতি থাকে। তাই আমার মনে হয় শহরের এলাকার মধ্যে দুটোই বোধহয় মানে সত্য। একটা দিকে গ্রামের তুলনায় শহরেতে শিক্ষা এবং মানে যে আমরা মানে আর্থিক সাচ্ছন্দ্য বেশি, তাই সেখানে যে মায়েরা তারা হচ্ছে বেশি খাদ্যে তাদের মানে অ্যাক্সেস আছে এবং তারা সন্তানকে বেশি খাদ্য দিতে পারে। এটা একটা শ্রেণী, যেখানে শ্রেণীর প্রশ্ন চলে আসে। আবার শহরের মধ্যে একটা অংশ যেখানে হচ্ছে যে শিক্ষা কম এবং খাদ্যের অ্যাক্সেস কম, সেই শ্রেণীতে কিন্তু মায়েরা মানে আন্ডার নারিশড এবং স্বভাবতই সন্তানরা সেখানে আন্ডার নারিশড। তাই আমি কোনো এক্সপার্ট নই এই বিষয়ে, আমার কাছে প্রশ্নটা উত্থাপিত হলো বলে আমি আমার সাধারণ জ্ঞান থেকে এটা বললাম।
থ্যাংক ইউ স্যার, অনেক ধন্যবাদ। অ্যাকচুয়ালি প্রশ্নটা আমারও মনে হয়েছিল এর যে উত্তরটা কি হবে তার নির্দিষ্ট প্যারামিটার নয়, অভিজ্ঞতা এবং বিচক্ষণতা দিয়ে যে যেরকম ভাবে এটাকে এক্সপ্লেন করবে, তো আমরা মোটামুটি স্যাটিসফাইড, বুঝতে পেরেছি। এবার মে আই রিকোয়েস্ট টু অনিন্দিতা ম্যাম to clarify the questions from Rishi Gopal Mondal. How important is mental health during pregnancy? How important is mental health during pregnancy?
Thank you so much for the question. I think it is extremely important because your mental health is not something that is, what do I say, it's not tangible. It is something where the chemicals in the body, you must have heard about serotonin, the neurotransmitter, which is synthesized from tryptophan. So naturally, that neurotransmitter coming from tryptophan, there is a complex mechanism. So this mental health is very important, and those chemicals will also be circulating in the bloodstream. I hope you understand that. Now, in this context, I would we have been talking about so many what do I say, bad things or heavy things or stressful things. I must mention that one good thing. We are always facing this question that all nutritionists do not or stop all sorts of food. Here, I would allow you to have dark chocolate. I'm sure we all love chocolates. And dark chocolate has been shown to increase mental well being, reduce depression in pregnancy, especially, as well as in normal conditions. So, it is very important to tackle the mental condition during that time.
Okay, thank you, ma'am. Next question. Vitamin D is related to innate immunity. So sufficient level of vitamin D can help to protect against coronavirus. Vitamin D related to
This
innate
is a
immunity. So
this is $1 million question, and I wish I could say yes to this question, but yes as an answer to this question. But unfortunately, there has not been any proven data. But I can mention at least 5 such journals which I have seen over the past few days of this corona crisis. At least 5 data which have shown positive results with vitamin D and vitamin D showing antiviral effect. Yes, it has. And there are certain countries also working on this, but I would not say that vitamin D can directly affect the virus, the level or the condition that the virus is in.
yes. Thank you, ma'am. Next question. Obesity harmful for pregnancy. Will it affect the fetus? Affect the
Yes.
fetus?
Absolutely, it will. Absolutely, it will. I'm sure all of you who are from the nutritional background, we always suggest that a successful weight gain, 11 to 13 kgs during the entire period of pregnancy, a successful weight gain is all important, is one of the most important factors that can lead to successful delivery, a healthy baby, and the growth. You must understand that if there is fat accumulation in the uterus itself, inside, there will be no space for the child to grow, the fetus to grow. And there will be problems during delivery. The mother will suffer from hypertension in most cases if she's overweight. So a successful weight gain is the primary factor.
Next and last question. There are many questions, but we have already completed our schedule or specified time. The last question, how to reduce weight gain during pregnancy using diet?
Oh, this is one of my favorite questions, but
ব্যবহার
what
করে
you have
আমরা
to do is,
ওয়েটটা কন্ট্রোল করব at the time of
একদম।
pregnancy.
আমি কি বাংলায় বললে সুবিধা হবে?
হ্যাঁ, আপনি তো বাংলাতে বলুন, অনেকে বলছে যে বাংলায় বললে একটু সুবিধা হয়।
আচ্ছা, অ্যাকচুয়ালি এটা খুব বড়
অনেকে
কোয়েশ্চেন, কারণ
রিকোয়েস্ট
এটাতে
করেছে।
আমরা আচ্ছা, সরি, আমি সেটা বোধহয় দেখিনি। তো ন্যাচারালি ডায়েট পার্টটা যখন আমরা দেখবো, ডায়েটের মেইন জিনিস যেটা ওয়েট গেইনটাকে আটকাতে পারে হচ্ছে ক্যালোরিজ। সো প্রথমে ভাবতে হবে যে দ্য প্রেগনেন্ট উমেন যার কথা আপনি বলছেন, সে কোন ক্যাটাগরিতে, সেডেন্টারি না মডারেট না। তাহলে আমি যে চার্টটা দেখিয়েছিলাম সেই অনুযায়ী দিয়ে ভাবতে হবে, এবং প্লাস 350 যেটা প্রেগনেন্সির জন্য, সেইটুকুনি ক্যালোরি। কিন্তু তার যদি অলরেডি ওভারওয়েট থাকে, আমরা খুব গ্র্যাজুয়েটেড, এটার একটা ক্যালকুলেশন আছে, ক্যালোরিটাকে কমাই এবং ফ্যাটটাকে কমাই, বাকি কিন্তু কিছু কমানো যাবে না। মানে ভিটামিনস, মিনারেলস, ফ্লুইড, ফাইবার, এগুলো কিছু কিন্তু কমানো যাবে না। সো ক্যালোরির ওপর একটু বেশি মন দিতে হবে, এটাই।
Okay, thank you, ma'am. On behalf of organizing committee, any questions? On behalf of organizing committee, I further convey my sincere thanks and gratitude to our respected speakers, Dr. Gishpati Chakraborty and Dr. Anindita Roy. In accordance with the advice of the organizing committee, Dr. Gishpati Chakraborty clearly pointed out the different health indicators like maternal mortality rate, infant mortality rate, different health risk factors, vulnerable issues, different types of lifestyle diseases, infectious diseases like polio and rubella, etc. Vaccine, undernutrition related issues, hygiene, sanitation, and pregnancy. And in the lecture of the Dr. Chakraborty, we have clearly gained an idea about the scenario of our health system and health status of the people. And in accordance with the advice of the organizing committee, Dr. Anindita Roy Chakraborty nicely delivered the topic on the different aspects of women health relation with the nutritional sciences. So I further convey my sincere thanks to our honorable speaker, respected speakers. So we have already completed our specified time. Now may I request to Barnali Chakraborty, convener of the webinar and in charge of the Women's Studies Cell, to say a few words on this occasion and conclusion remarks.
Audible?
Yes, ma'am.
Respected principal, honorable dignitaries, distinguished guests, faculty, students, and dear participants from different colleges, universities, and other organizations connected online. On behalf of MUC Women's College Burdwan, its entire faculty and organizing committee, and on my own behalf, I feel immense pleasure to take this opportunity to propose to our eminent guest, Chakraborty, who spared the time from his busy schedule for this webinar. No doubt his thoughts will help us to extend our knowledge of women health in COVID and post-COVID situation. Thank you, sir. I would like to convey my deep regards and heartiest thanks to our esteemed guest, Dr. Anindita Chakraborty, for accepting our invitation. We have learned a lot of knowledge from her fascinating lectures and hope to learn more in future. Thank you, ma'am. I also wish to express my profuse and sincere thanks to our principal for his encouragement, advice, guidance, and support throughout the process to organize such event. I would specially congratulate heartily our beloved secretary, Dr. Kazi Manjur Ali, for providing opportunity to organize such a webinar. I'd also like to convey my heartfelt thanks to Mr. Sujan Shaha, Mr. Taposh Kumar, Mr. Raju De, and their team for all types of technical support. Last but surely not the least, my deep sense of appreciations and thanks to all participants who chose to be live with us with great enthusiasm and made it successful. Thank you all once again for being with us. Have a wonderful, great day ahead. Thank you, sir.
Hello, dear participants, we have complete our session. Now you are requested to fill up the registration form, which will be shared in the YouTube link within 10 p.m. today night. You are requested to submit the registration feedback form. Then you will receive the e-certificate. Thank you all. Good night.